Hey guys, I wanted to just take a second and talk about posture. Posture is so important for so many different reasons. One of the biggest reasons that I value posture and make sure to teach it to my patients is that's the optimal position for the body to function in. There's posture in sitting, and as well as standing, different things that we can think about. But the idea behind posture is to get those muscles and joints in an optimal position so they don't have extra pain and they also can perform at their best. So there are two things that I focus on with my patients. There is your rib cage. I'll stand for this. My face will probably disappear, so I apologize. But your rib cage that sits right here and protects all of your organs underneath it, okay? And then you also have, I'm just gonna just a little bit back, your pelvis. So it kind of sits here in this position. So you have your rib cage that sits in this position and your pelvis in this position. So I call this your belly bowl, okay? The top of our rib cage, bottom of our pelvis creates this position. When we have a posture where we stand, and it's kind of the lazy way to stand, we hang on these front ligaments of your hip joint, and you kind of hang out here. Okay, as you can see, I kind of have a little bit of extra sway in my back. I'm kind of sticking out my belly a little bit with this posture. Okay, in this situation, you put your core muscles on stretch. Okay, so you make them a little harder to engage, and you kind of put some compression on your low back. So for me, when I'm trying to cue my patients what to do, I will say close your belly bowl down. Okay, so at that point, you're taking your ribs right here and your pelvis bowl down here, and you're finding that neutral position. So a lot of times I'll tell people work kind of into the extreme on both ranges, and whatever's in the middle is most likely that neutral. So from this point now, I have my top belly bowl, my rib cage, and my pelvis bowl stacked on top of each other. So I'm not in this position. This is what I would call a rib flare up here, so your ribs stick out. And as you get into that position, you lose the ability to breathe effectively, as well as, again, those core muscles are on stretch, so they're not able to engage and protect your low back and work as you would want them as you're standing. So this is the position you're best optimal able to move. So again, each extreme, find that middle. Think about closing your belly button down. You should feel your core engaged, as well as maybe your butt cheeks a little bit tuck under. From that point, I would encourage you to try to breathe while maintaining that point. I also would challenge you to kind of play with these positions, and then when you're sitting in a chair, same thing. You can kind of go back and forth, and then find that middle. That's where you're most stacked. That's where the gravity has the least effect on your low back and different structures in the body. When you're doing any standing exercises or seated exercises in the gym, check out your posture. See where you're sitting, see where you're standing, and then stack yourself. Put those vertebrae, those bones in your back on top of each other. Put those ribs in an optimal position and that pelvis in an optimal position to recruit the muscles you need to safely protect your body and be effective.